was the American Telemedicine Conference, and one of the things I was amazed about is the huge international presence that was there. There were people from every walk of life and everywhere around the world really coming together to try to bring medicine to the patient in their home and in the community to help improve the health of the population by keeping people out of the acute care settings, and really trying to care for them using their family members and their care team to do so. On Monday morning, there was a speech by the CEO of the United Health Group, and he was commenting on the fact that they touch tens of millions of patients through their insurance and through all of the organizations that they work with. And one of the numbers that really jumped out at me was the fact that they're only touching 20,000 patients right now using telemedicine. So my big, huge takeaway is that we're really only seeing the tip of the iceberg. One really easy thing is that, there's people in rural areas or even in cities who either can't get out of their homes or can't realistically get to providers easily without using lots of public transportation. Some people in rural areas don't have cars and have to travel 50 miles to see a practitioner, and it's just not realistic. And instead of doing that, they will just miss these appointments, or they won't be able to get to a provider, and whatever illness they're trying to treat will get much more acute and much more severe before they can actually seek care. And then they generally have to seek care in an acute care setting. But the other thing is, you see these huge populations of people with cancer, with heart failure, who go home from the hospital after being admitted, and with very simple instructions can care for themselves at home using very simple care plans, health journaling, secure messaging, surveys, and tools like that to communicate with their providers, and to be able to, with congestive heart failure, a simple thing of getting on a scale every day and weighing themselves and making sure that they stay within a certain weight range can keep them from being readmitted. So not only is it huge to keep the patients healthy, but it helps decrease the incredible financial strain on the healthcare system by trying to keep as many patients out of the hospital as possible. M3 is a screening tool to help determine whether or not patients are experiencing certain mental health disorders. Very simple, short screening tool that we can use to help decide where in the spectrum patients fall, if they're at very low risk or very high risk. My poster actually was talking about using a mobile technology to treat the mental health community. And one of the big things about the mental health system that we don't realize is how much money is spent. It's estimated that over $132 billion a year is spent in loss in productivity and healthcare costs in treating the mental health population. And when you have a comorbidity of mental health, it's 3 times more expensive to treat diseases like cancer and diabetes, congestive heart failure. So it does add a huge strain onto the financial resources of the healthcare system. By being able to screen these patients and being able to treat them where they're comfortable, which is their home or out in the community, we're able to keep them much less acute. Some of the things that were found in the study that was done were we were able to decrease readmissions for psychiatric issues. We are able to keep patients more compliant with seeing their practitioners, which is huge in the psychiatric realm. If we can get these people in to see their practitioners, oftentimes they can be treated without becoming acute. One of the other things that I thought was so interesting was that we were also able to tie a decrease in the number of arrests in this population by being able to use a mobile device to help record their symptoms and keep them compliant with their care, because compliance is the number one thing in the mental health community to keep people on track and caring for themselves.